Welcome to Goal Getter, the AAP Physiotherapy podcast. My name is Jen Panteluk, and I'm the CEO of the Alberta Association of Physiotherapy. This show explores the power of physiotherapy, helping individuals move, heal, and thrive. Let's get moving. I'm really excited today to welcome Ryan Williams to the podcast. Not only is he the physiotherapist to the Oilers, but he's also a great wealth of knowledge when it comes to physiotherapy for your everyday person. So, Ryan, welcome to the podcast.
Thank you very much for having me.
So, let's talk a little bit about your background as a physiotherapist. Was sports physiotherapy always where you wanted to land when you were thinking about the program?
Yes. I think, like a lot of physiotherapists, that's often what draws us into the profession. I'm not going to speak for everyone, but I know a lot of people, this ability to work in the sporting side of things is what gets them there. And then they start to see all these other different avenues that are involved, and they often branch off and maybe work in an area of physio that they didn't think they initially would. And I was certainly open to those, but the opportunity to work with athletes, to work in a sporting environment is what drew me to the profession and what continues to kind of fuel my passion even now.
So, was working for a professional hockey team kind of one of those dream jobs that you always aspired to?
I mean, there's only so many jobs that are out there. There's a lot of people that would want to do that job, and it's not something that would necessarily pan out, but through some good experiences and getting to network with some great people, it was just fortunate enough that it worked out for me. And I think whether you're working in pro sport or not, if you enjoy working in, for me, a team atmosphere is what I really enjoy the most about it. Whether it's working for a minor level team, amateur, kids, or certainly non-professionals, that can sometimes be just as rewarding. And I look back at some of those experiences earlier in my career, and they were some of the funnest times, and like I said, the most rewarding as well. So I think the sporting world has a lot to offer physiotherapists, and we have a lot to offer them at whatever level it is.
Absolutely. And I think, whether it's the sporting world or just those that are trying to keep active in their everyday lives, physiotherapists play such an important role on that journey. I know all of our listeners are probably really keen to learn a little bit more about what it's like as the Oilers physiotherapist, and maybe what a typical day looks like for you during the season.
In the season, the days are they're busy. They go by really fast. I work as part of a large medical team there, so we often start the day off in the morning with a meeting, and that team usually consists. We've got 3 athletic therapists, massage therapist, a chiropractor, myself, 3 members of our strength and conditioning staff, and we'll have a nutritionist that will sometimes be on hand, and every now and then a doctor as well. So we'll get together, have a morning meeting just to go over the daily schedule, go through the roster, and update kind of the health status of each one of the players, put our heads together, share kind of what our plans are, if we're going to be doing any types of treatment or testing, kind of bounce that off each other if we need to. And then from there, my primary responsibility is treatment of any injured players that are out of the lineup, and to also help out with any injury prevention with players that are continuing to play. So we'll do treatment before any practice or morning skate. And if we're not skating on that day, usually there's still treatments offered. That's where I kind of do what my training is as a physiotherapist. But there's often things that we'll get into that I didn't learn in school. So sometimes you're helping out with some equipment repairs, or running a pair of skates to and from the bench. Sometimes you're assisting a doctor who might need someone to snip a set of sutures that they're doing during a game. I've moonlighted as a dental assistant in some instances. So you end up wearing many hats, and you go, yeah, I didn't learn this in school, but you've got lots of professionals around you that do. So that's, things that will fluctuate from day to day. But the main things that carry through on a daily basis is doing kind of that player rehabilitation and prevention. That's often kind of a shared responsibility with myself and with the other therapists that I work with. When the team is away, then there's not quite as many people on hand, but still myself and a few others are around to help manage the recovery and the rehab of the players who are out of the lineup. So when that's the case, I have more of a coordinating role to organize, having if I need a skating coach or a goalie, and organize the player's schedule with them for those times. I enjoy it a lot because there's a lot of different avenues that I end up getting into, lots of different rehab techniques depending on the stage of recovery that a player's at. If they have to skate the first few times they're out on the ice, usually I'll go out with them to kind of just get them back into kind of doing some of the basics of skating and making sure that their body's adapting well before they might start to work with our skating coach, working closely with the strength and conditioning staff to kind of start to bridge the gap from doing rehab to more performance types of training. So there's lots of variabilities in my day to day, and there's always like lots of problem solving and challenges. So each day is a challenge in a different way, and that's, I guess, what makes it so enjoyable.
I love, you're talking about the members of the team and working together in that coordinated effort to make sure that the whole player is looked at when you're kind of looking at that recovery journey or the prehab that might be required to keep them on the ice and not injured. How important is that daily check-in with like the members of the team and considering all the different disciplines?
It's extremely valuable. I'll say that because information is so key. Different conversations are happening nonstop in that environment, and some of them might be happening in the gym. Some of them might be happening in the medical treatment room. Some of them might be happening on the bench. And so having lots of ears around, or people that, if maybe a player has a conversation with one of our strength and conditioning staff in the gym, might say, geez, shoulder's a little bit sore today. They might not think it's a big deal, but our strength staff will just say, hey, just heads up, this player mentioned this, might be worth, one of the therapists checking in on them. So we really help each other out. We work together. They're not part of the medical staff per se, but we've got equipment staff there as well, and they're always in tight quarters and communication with the players, kibitzing with them, and sometimes they'll even, chime in a little bit or give us the heads up as to different things. So it's really a team approach, a team atmosphere within the team. So you've got the whole team of all the players and all the staff, but then we've got, our smaller teams from there, our strength staff, our medical staff, and we're all working together, and communication is really the key to help each other out.
So you mentioned that, part of your role is focusing on those players who are off the bench and recovering from injury, but then you're also looking at how do we keep the players in the game and making sure that, we're reducing the risk of injury as much as we can. Can you talk a little bit about, are there certain treatments or exercises that you tend to lean towards a little bit more when we're talking about that prehab for the players?
It really depends on what you're finding. So it all comes down to kind of assessing, what you're dealing with. So part of that is, often it's just a player reporting, I'm feeling a little bit of an issue here or there. And then you'll do an assessment on that area. Sometimes it's noticing something. Geez, someone doesn't look like they're moving the way they normally do, or doesn't look like they have as much maybe power in their stride, or they're not shooting it as well. Sometimes it's again, maybe someone doing an exercise in the gym or working out, and something's not looking right. So it all comes down to the evaluation. And if it's something the player's reporting, that's the easiest. And then you can take a look at them and see if, something's a little bit tighter or not moving as well as it should be, or maybe there's a muscle that's not firing or as strong as it should be. And then that's what you'll get into. And there's, countless different types of exercises to stretch or to strengthen. And, we use a lot of different approaches amongst the different professionals we have. And that's one of the great things about having a big team to work with these players, is we've got a lot of backgrounds and to draw upon. So everyone kind of brings a little bit of a different flavor to the table. As far as, different techniques, we do a lot of hands-on manual work, whether it's joint mobilizations or manipulations, massage, soft tissue release techniques, active release techniques. We'll also utilize, different modalities to help control or modulate pain, different forms of electrotherapy, compression devices, icing devices. Aquatic therapy is a big one that we'll use. Hot tubs, cold tubs. We've got an underwater treadmill, which is one of my favorite things to use there. And people always ask me, well, what kind of like latest cutting edge things do you use? And I'll say, well, the biggest thing we use is the pool. And that's not like, everyone thinks it's got to be some type of cutting edge device, laser, you always hear that. You think, oh, laser, that's going to be doing something. Just working in the water, offloading a joint, being able to use the water to provide resistance if we want it to provide resistance. Sometimes just to cross train, we'll even have a player swim. Do swimming as a form of training, especially if they're not able to skate to get their conditioning.
How graceful are they in the water? I can just imagine like a hockey player transitioning into a pool.
Some of them are actually surprisingly good.
Nice.
Others tend to swim, more like a rock. So there's a variety, but they're all fairly keen to do it. Now, pretty much to a man, they enjoy kind of the variety because it's something that they maybe aren't doing typically with, their training in the off season or as part of perhaps their rehabilitation, maybe when they've been in other places or on other teams. So they generally respond very favorably to something a little bit different like that.
And when it comes to the off season, are there certain recommendations that you might make? Do they focus in on a little bit of strength, on like flexibility, anything that they might do differently than in season to help make them stronger for the next season?
Yeah, their training will be a lot different than in season for sure because of how condensed the schedule is. Basically in season, it's all about maintenance and recovery more than anything. And then the off season will be used to really try and make gains in, whatever they need to improve the most on. Pretty much they're always going to work on some amount of strengthening, power development, speed, agility to a certain point. And then certain players may have more of an emphasis on certain one of those areas, depending on what parts of their game or just of their general athletic makeup that they need to improve on. What we'll look at from an off-season standpoint, especially if a player is coming off of an injury during that season, or perhaps some players are just more susceptible to being tight in a certain area. And, we'll often do screens both in training camp and then at times throughout the season to just get a general overview of how a player's body is moving, is performing, and then we can make, kind of identify some things that they need to work on. And we will implement a lot of those corrections as best we can in season, but then off season is when you can really dive into them a little bit deeper. So often areas we might want to work on if someone has, say stiffness in their shoulder, maybe they're coming off a shoulder injury and it's improved to the point where they're competing, but often we'll see, even though it's functioning well enough to perform and play well, there can be lingering effects for a number of months, just like with any injury for anybody. Often, healing is occurring over a number of months. And so we'll continue to emphasize or incorporate things that they can work on during that off-season training program.
So when a player does have the unfortunate circumstance where they are injured, what does the rehabilitation process look like so that they can return to the ice safely?
It's definitely a process. The initial acute phase, obviously, it's more focused on reducing pain and swelling, making improvements in range of motion, general strength, get them, perhaps just able to move without pain. And then, once certain criteria are met in all those categories, they'll advance to more of a training environment where they're able to push their body a little bit more as far as just being able to generate more force or move a little bit quicker. Once we see progressions happen off the ice, then we start making the transition to on ice. Once they can demonstrate certain abilities and body's showing capacity to perform it to a certain standard, then we'll transition to skating. And As I mentioned earlier, that'll usually just initially be working with a therapist, getting them used to being able to accelerate, decelerate, stopping, turning, change a direction, being able to do things with a puck, incorporating shooting, things like that. Usually progressing, handing it off to working with a skating coach. And once they reach a certain level, then it's transitioning into practice with the team. And usually at that stage, then there's the eventual incorporation of adding full contact. So they'll initially start with a non-contact situation in certain circumstances, and then once they're getting close to being able to return to play, it'll be full practice, and then eventual return to game. Along the way, there's a lot of monitoring from different levels. Certainly from like the therapist side, ensuring certain amounts of mobility, strength, balance is all being met. From the medical side, just ensuring healing is occurring as it should. Sometimes there's follow-up imaging that'll be done to make sure proper tissue healing is occurring. Performance staff is often monitoring different metrics to see how just overall strength, for instance, or power, or whatever measure we want to see is progressing. And we tend to track a lot of data on players. And so often we'll do this ideally when they're healthy. So we'll do a lot of testing in, say, training camp, and it helps us to know kind of what a baseline is for a certain player. And then if they're coming back from an injury, or even if sometimes we'll just check players from time to time to see how they're doing, even if they're not necessarily injured, but to see if there's any deficits that are creeping up. And then we can use that as guidelines too. So in an injury situation, if they're starting to come back to levels that they were at when healthy, then that's usually an indication that it's green light to progress to the next level. If it's somebody perhaps that isn't injured, but maybe we've had some indication to look a little bit closer at them, sometimes you'll see things where, oh yeah, there's a little bit of deficit here. It's sneaking up on them, and we can implement something to intervene before it turns into a bigger issue.
Right. Again, back to that prehab and making sure that they're monitoring their bodies. Others are looking for different signs and indications. Would you say that baseline measurement is one of the factors in helping to determine when they're ready to return to play?
It's definitely helpful. Maybe not the only thing that'll be utilized. There's often the incentive to try and exceed that baseline. We don't want to just get them back to where they were. We want to exceed that as best we can, and always be striving to be better all the time. So it's useful, but it's part of a bigger picture too. There's input coming, each of the levels that I talked about, medical side, therapist side, performance side. Then on ice, we have the coaches that get involved, evaluating if a player is performing or looking to be at a certain standard. There's on ice testing we'll do again to get more data to utilize. So when you have that baseline, it's definitely helpful. We don't always have that. Certainly getting players in, through trade or acquisition, you don't always have that signature of them. And so then you might be looking to compare them to kind of what we know is typical for that type of player, that build of an athlete, or perhaps a player that plays that position. So with the data we have from the players we have and collecting it over enough time, we can kind of know what a relative normative level is, obviously accounting for some discrepancies person to person.
I think that's one of the things I love most about physiotherapy is there's so much that's rooted in data and in evidence to help to inform like best care and the path forward for any individual.
Yeah, absolutely there is. And there's a lot of it out there, which is a great resource to us as a profession. There's a lot of people doing great work to kind of help guide us and to help make decisions regarding, many different injuries and rehabilitation techniques.
I think, NHL players, other professional athletes, they have access to physiotherapy every day. What lessons can amateur athletes, kids, your weekend warrior, What can they take from professional sports rehab and injury prevention and apply to themselves as they're pursuing their sport of choice?
A lot of things, but perhaps the biggest one that I see, and I do treat clinically aside from my time with the Oilers. So my days are split between them, and I also work at a Glen Sather Sports Medicine Clinic. So I have a clinical practice, and I see the amateur athletes and the weekend warriors. So it's you know this a common thing that I see, and you hear the old phrase "prepare like a pro," and sometimes that's a big difference that I see. Even well, in the professional level, you take a veteran that's been in the game for 10 years and you see what they do compared to maybe someone who's a little bit newer on the scene, then there's quite a discrepancy. And then you take, anyone at the professional level compared to someone, say, at a junior university level, and you see a little bit of a difference there. And then as you kind of just work your way backwards, there's the level of preparation is often at a different level. I think there's a lot to be learned from the way that a professional prepares themselves, commits themselves to a certain level of recovery, because that's an important part that sometimes I think the recreational athlete doesn't consider enough.
Right.
There's a lot of motivation with recreational athletes, enthusiasm, and we tend to, I say we, because I sometimes put myself in that category. When we get the fire, we tend to go after it hard and then realize after, whoops, maybe I'm not ready for that, or my body can't do what it once could. So I think that's a key thing that we could all easily incorporate at any level of activity is, ease into things. If you're going to start doing something, maybe you want to prepare for it, train for it, allow for proper recovery and rest in between bouts, especially as you're just starting to get into something, whether that's getting proper sleep, proper nutrition, hydration, things like that. And I see with certain athletes can certainly get away with it, I think, if you want to call it more amateur level, and still be able to perform well enough at that level to be effective or to be dominant. But I think as you get into the more elite, it's not an option. It's a necessity to be paying close attention to those types of things. I think the saying that kind of really has a lot of meaning is an ounce of prevention is worth a pound of cure. It's tried and true, I would say. Putting in a little bit of time. We all know we should stretch. How often do we stretch before we go and play our recreational game of basketball or soccer or whatever it is? And it can just putting in a little bit of time, a little bit of preparation can go a long way.
And do you find, so again, wearing two different hats, sometimes those, more amateur recreational athletes tend to maybe push themselves a little bit too much, or kind of like shake things off a little more? Oh, this is just part of me, like getting back into a sport, versus really listening to their bodies. Like, do you find like one demographic versus another is worse for maybe slowing down or taking the time to recover?
Well, I would say definitely yes. I see that a lot. So many, like I said before, the enthusiasm is there, and sometimes a person, what they picture themselves as being capable and what their body is ready for can be two different things.
Right.
I
Yeah.
think a lot of us can probably speak to that. I think that's definitely a big issue, and sometimes even you'll see it even at the higher levels. Sometimes you know the expectation that it's just it's nothing major, it's just a little soreness or a little tightness, and sometimes an athlete is almost groomed to like be able to push through pain. That's what gets them a lot of times to be able to perform at a certain level. um, so even they will tend to push themselves perhaps further than what would be ideal, and hats off to them. Usually they can push through a lot more than what just your average person would. and it's incredible. I've seen some athletes be able to perform at an extremely high level, on the ice, for instance, and not be able to really walk without a bad limp off of it. Something that would be extremely difficult for anyone else to do. It's commendable that they can do that. It's maybe not the most ideal thing to make a habit of,
Right.
as far as what's sustainable in the longer term.
Right, longevity in the sport and wanting to stick with it for any length of time.
Yeah, exactly.
Are there any really common injuries that you see with amateur sports or more of your recreational athletes and how can physiotherapy help maybe in more of a preventative capacity, or when should you maybe seek physiotherapy for certain injuries?
As far as types of injuries, a lot of it depends on the activity or the sport. I'll use hockey as an example, just given the position that you're in with skating, the skating stride kind of being really crunched up at the hips and bent forward at the lower back. We tend to see some issues in that area a little bit more often, relating to the impact nature of the sport, often shoulder injuries from collision, maybe a sprain of the AC joint or the top of the shoulder, or sometimes dislocations. Then also due to the dynamic nature, change of directions, and getting hit, knees tend to twist and sprain, and ankles, while not your typical rolling of the ankle that you might see a lot in soccer or basketball, but in hockey you'll get these nasty high ankle sprains where the foot really twists, and usually they're the ones that you see on the sports highlight shows that sometimes make people's stomach turn. But if you're a physio, you go, oh, cool, hey, look at that. And then you try to guess what the injury is. Go on social media and let the world know. So that's from a hockey standpoint. From that perspective, prevention for a lot of the movement-based stuff, like the hips, the low back, sometimes like abdominal or groin strains, goes back again to your screening, your assessment, being able to pick up if there's imbalances. Is there certain muscles tighter than they should be, certain muscles maybe a little bit weaker than they should be, and then you can hone in on those to make that correction. From the impact side, it's a little harder to control. Certainly, equipment plays a big factor in that. Making sure they're using appropriate equipment and making sure it actually covers the area that it's supposed to can play a role as well. To get away from hockey and just the sporting world in general, if it's more of a throwing or a racket sport, certainly naturally we see a lot of shoulder, elbow injuries. Often the core can be involved with those. If it's more of a field sport, a court sport, lots of running involved, naturally more of the ankle sprains, knee sprains, things like that tend to come. And again, related to amounts of training, overtraining or undertraining can play a role. Sometimes we'll see overuse injuries. And again, the preventative side comes into, if you're able to evaluate these things in advance, it's very helpful. And that's what I'm fortunate to be able to do in my job in pro sport. That's not possible with people that I see on the clinical side. And I think people can help themselves out a lot in just being mindful of, am I not doing enough to prepare myself for a certain activity? If I haven't thrown a ball in 3 years and I'm now going to go play baseball with a team, should I be, pitching 3 games in one weekend? From the physio side on how we help with these things, in the clinical side, what's done is done, and then you're managing kind of that acute phase care, reducing pain and inflammation, and trying to accelerate the return. If someone's already hurt, your prevention is starting at the end of that, what we think of as a rehabilitation cycle. You want to make sure that this doesn't become something that recurs or becomes a longer term thing. So making sure that an injury is fully rehabilitated is probably the first step in a good prevention plan.
For an athlete who is maybe thinking about ramping up, or to your point, maybe they did something back in high school or university, it's been a few years, they're thinking about jumping back in and like more of a recreational aspect, or, you always hear about people training for their first marathon or 5 kilometer race. Do you think there's value in going to a physiotherapy appointment and really just diving in and like having some assessments done to identify imbalances before you throw yourself deep into any sort of training? Or
Oh, absolutely. There's value. Physiotherapists are somewhat experts in being able to evaluate movement and break those movements down into their component parts, being able to see, what areas are moving well, what might have some limitation or restriction, and then being able to do a proper evaluation to see what can be done to help with that. Implementing a plan, giving some advice, and that's probably the big thing that lots of times we think about treatment. Doing something hands-on, doing something active to improve, and that's important to do. But just giving someone some advice. Okay, this is maybe what you could do with your training, or this is something to consider doing to help recover from what you're doing on more of a regular, whether it's daily or level or whenever they're being active, that can be valuable. So I think there's lots in kind of in what we would think of as a preventative realm or pre-injury that can be valuable for anybody that's looking to maybe start up something new. They want to get involved in a sport that they haven't done in a while, a new sport, or they just want to be active. They just want to start working out a little bit more. Sometimes, again, it's just a simple evaluation, identify maybe if there's some weak links in their chain. And what I mean by that, if there's, some of us are a little bit more susceptible to moving maybe not as well in a certain area or moving too well in a certain area, and addressing that ahead of time, or, when you first start to notice it, I think can be very, very beneficial.
do you think very many people are proactive? Or do you think the majority of people you see outside of like the professional sports realm, it's more of a reactive, help me, I'm injured, I need to, like, what's the path forward to recovery?
Yeah, definitely more in the reactive side for sure. I would say I'm seeing more and more people becoming more aware of the benefits of doing things proactively, taking steps to reduce risks. I think the message is getting out there. I think people are starting to see the value in doing a little bit of prehab, I guess, if you want to call that, to help address that area. Yeah.
I think it's like a really important piece, and something that we don't dial into enough as a profession is talking about like the opportunities to get ahead of it. Like, that's why are we always such a it's healthcare in general. We're a very reactive society. We wait till something's broken to fix it, and we don't always think about, what can we do to prevent certain things from happening to keep us, away from those injuries in the first place. Well, and I guess this is like me like pulling in my personal experience. So last year everyone's like, why are you going to physio? I was like, I'm actually going for prevention because I had some major competitions and I wanted to, I don't know, some stuff didn't just feel quite right. So I wanted to dive in and figure out what those imbalances were. And then we strengthened them so that I could make it
Absolutely.
to the start, not only the start, but the finish
That's
line of all my races last year.
And you did it.
Yeah. And
You
it worked and it was
good.
great. Right. And so and I think as you mature as an athlete and you listen to your body a little bit more and you're just in tune when things are not quite feeling right. And that was 100% me last year. I was like, something is off, but I can't quite place it. So again, I went to see a physiotherapist, and it was really funny because the start of the conversation was, I mean, obviously the assessment and trying to figure out what the challenge was. I'm like, well, I'm actually not broken. I'm going to prevent myself from getting broken as I like ramp up my training for the coming season. So I just, yeah, I think there's a lot of merit to really listening to your body and understanding when things are, it's not an injury, but it's not quite right either. And so I guess maybe from your perspective, Ryan, what might be some signs for an athlete, any level, like professional to someone who's going to pick up a sport for the very first time and has never, tried it out? When should they maybe seek physiotherapy, even if they're not like fully injured?
Yeah, I think if they're doing something new that they haven't done before, and maybe they're not really sure or confident in their ability to do it, that would be one instance. If there's changes in their performance that they're noticing in what they're doing, maybe they can't throw the ball. They don't feel like they've got as much kind of pop when they throw a ball, or when they're running, they feel like they can't quite get to that top speed or accelerate quite as quickly. Also, if they just notice a little bit of a difference in the way they feel, they might find that, certain parts of their body are just feeling a little bit heavier, is a term that's often used, or not quite as energetic, don't quite move or have as much strength as they felt like they have previously. Those would definitely be maybe some subtle signs that it'd be worth, getting something checked out, getting it assessed, because there more than likely is something that's contributing to that. And so often we use pain as that indicator, to as that like siren. Okay, I need to seek help or get some advice, but it doesn't always need to be that. And often, if you can get in front of that, then you can avoid maybe having to experience that pain, having to go through an injury. So, sometimes it's just as simple as just the confidence and the ability to do something might sometimes be the first indicator.
And when someone is experiencing pain or, maybe have some, even at an acute level, an injury, how often do you find someone comes in and they're like, my heel is bothering me, but it's not actually their heel. It might be like connected to something else. And I think that's one of the great things about what I love about physiotherapy. It's like you assess the whole body, because often what they come in for might not actually be what's causing the issues in the first place.
Absolutely. So often that is the case. And it's part of the challenge too, of really trying to dive into somebody's the way they move, or the way that their body coordinates with other parts of the body, the way their shoulder moves. But yet, is it because their core isn't engaging well, or their hip isn't strong? So often that's the case. And the initial tendency is to always go, where does it hurt? Oh, it hurts, right here on the tip of my shoulder. Even though the issue quite often is driven by somewhere not even close to where the pain is being felt. So it makes it kind of, I guess, challenging but fun doing what we do as physiotherapists, but also challenging for an athlete too, because often they'll go, oh, okay, for instance, shoulder's a little bit tight. I'm just gonna roll it out a little bit, do some extra stretching for that area. Should be fine. And sometimes then things can escalate, relatively quickly if they keep pushing it. And it's not always so easily as using Dr. Google to figure out, what's causing that pain. And
I was just going to ask that. How many people come in and be like, I Googled this, I got it, this is what's wrong with me?
Yeah. Well,
Do you get that a lot?
All the time.
Yeah.
And how could you not, right? I mean, information is so accessible now, and really it's a good thing, but people are coming in with so much more knowledge and education about their bodies. And so they'll come in, and often they'll have their diagnosis already. And sometimes you go, yeah, I think you're right. And you've already started part of the treatment, and that's good, but maybe we're going to do a couple other things, or do this a little bit differently. And other times it might be a complete 180, something a lot different, or being caused by something that wouldn't be expected. So that requires a little bit extra time to just explain things to people, give them that education. And again, the time to explain someone's condition and why it's happening. People really appreciate that. And I get a lot of feedback that, you might have people that have seen a lot of other professionals for a problem, and surprising how many people will just say, thanks for taking the extra time to explain what it is, why it might have come about, and what can be done. Sometimes I think the thought is that treatment needs to start, and it needs to be something that, a person feels, or a movement that they're doing. Not that that's not important, but I think there's a lot of value in just the education side of injury and recovery.
I think that's huge to be able to understand your own body, and then also understanding what you either A, did to land where you are, or B, what you can do to prevent that from happening in the future. And yeah, I know I personally always appreciate when I go into appointment. I love when all of the different diagrams get pulled up and be like, okay, so like this is connected and this is actually what's causing your issue. And I walk away feeling like, okay, I've been heard and I actually know the root of what's happening or the path forward, and I have a really good understanding versus feeling sometimes like you just got a Band-Aid put over it.
Absolutely. And information is powerful and it can be used ongoing. And whereas the Band-Aid is going to fall off fairly quickly at some point in time, if someone has the knowledge, they can utilize that for the rest of their days, or as long as they so choose. Hopefully it's good knowledge.
Yes. Trusted source.
Yeah, that's right.
So one of the areas where I think it's really interesting, and maybe just dive into it a little bit, but youth. A lot of youth are really focusing in on a single sport early on. Maybe sometimes it's parents pushing them to be like the next pro or high level athlete. When should kids start incorporating injury prevention strategies, or really thinking about, how do they build up their capacity?
I think any time is good as far as injury prevention goes. Simple things like warm up is very commonplace now, so basics are there. Sometimes being able to identify, like with a certain sport, what areas are more at risk. That's maybe what can be elaborated on, and might fall short a little bit in just the kind of the basic programs that are out there. I think the most important thing with kids is to address injuries early. Great thing about being young is generally young people recover or heal faster. So with certain things, kids will bounce back fast, and if you've seen it happen once or twice, the tendency is like, they'll be okay. They'll get over it quickly. And in some cases that's true, but not always. And if an injury is allowed to become re-aggravated or to escalate often, and it becomes a small problem, can become a big one fairly quickly. The ability to intervene in a timely manner, I think it can really do a lot of good to help kids. They tend to, as I said, heal quickly, and when they have that help, and in an early stage, it can make it even faster. The issue that can come about, and there's some literature out now that supports this, is that when kids get injured, fortunately, especially if an injury maybe occurs again later down the line, then it can set them up for problems long term into their adulthood and beyond. Down the road, start looking at degenerative conditions, osteoarthritis, things like that. So we're starting to get more information on the importance of properly rehabilitating these injuries earlier in life, in childhood or adolescence, so that it doesn't become a problem that affects us later in life.
And as a parent, what is your advice for, really taking a child seriously when they're saying something hurts versus telling them to shake it off? Because I know there's that delicate balance of when a child is hurt, and I guess maybe what are some of the things to be aware of where maybe it needs a little bit more attention than you might think?
Allow the initial reaction to settle, because I know from my experience, simple bumps can sound like massive fractures initially with the reaction of the child. Things to look for is really, obviously, if in an early setting, early response, swelling, discoloration in the area, if things are looking out of place, obvious deformities, that needs to be addressed right away. Sometimes it's like, okay, well, they say their foot hurts and, it doesn't seem too bad. They might be favoring a little bit. If someone's limping, usually that's an indication that, something can hopefully be helped, or should at least be evaluated to look for that. So that's a couple things. And if it tends to linger, and lingering would be more than, if it hasn't improved within, a couple days, then I think it's probably worth getting checked out. It obviously varies person to person how much it's going to affect them, and depending on the severity of the condition. But I think there's a lot of value in seeking out help or advice, evaluation. It may just be something simple, and again, it can be helped fairly easily. It doesn't turn into something bigger, or it may be something that, it's if it was left, it can really turn into a big problem. So why not get it checked out and just make sure that everything's going to be okay?
Absolutely. Making sure it doesn't lead to something further down the road. I always think about the story. My husband's mom was a nurse, and he broke his arm, but she's just like, you're fine. You're fine. And a couple of days later, she went in and took him in, and his arm was broken. So I always think back to, and now as a parent, I always put that hat on. I'm like, how bad is this injury?
I mean, kids are so resilient, and I mean, we've all kind of seen them have that nasty fall that makes you just cringe and think, oh, this could be really, really bad. And they just pop up and they're fine, or they might shed a tear or two, but then within minutes they're they're back at it. So they kind of condition us as parents to be like, they're fine. They'll get over it. And a lot of times they are, but sometimes that's not the case. That's what we're here for, if that is.
Do you think that physiotherapy is underutilized in amateur and youth sports?
It might be. I think it's becoming well known, the value that it offers. I think what physio can provide is becoming more mainstream. The message is getting out there. Our ability to address problems, find corrective patterns for it, identify, potential risks if that's the case, if it's something that hasn't manifested itself as of yet. And again, I think the message maybe could be improved is just knowing that physiotherapy can be like an initial point of care. The emergency room doesn't have to be the first stop, or the doctor's office. Certainly there's the instances where that needs to be the case. If bones aren't sticking out at funny angles, or joints don't look like they're dislocated, a lot of things are appropriate to be seen first by a physiotherapist. And we have the ability to do a proper assessment, identify what likely causes are, and if it looks like it's something that does require more advanced level care from the medical side, need to see a doctor for getting an image, whether it be an X-ray, ultrasound, MRI, etc. Then that referral can easily be made. Physiotherapists are very skilled in not just saying, okay, everything is going to need this treatment or that treatment, but be able to truly evaluate and make sure that the person is treated best, whichever profession that might be required. We can make sure that they get there.
Yeah, and I hear that all the time, right? Like that assessment piece is so important to make, like directing into that right pathway for care. And, sometimes, to your point, physiotherapy is that correct pathway, and other times it's recognizing other healthcare practitioners that need to be brought into the mix for that journey for that specific patient.
Yeah, absolutely. It's the ability to have a good network, to be able to work with and know other professionals that one can rely on is like a huge asset for a therapist to have. Whether it be connection with certain doctors, massage therapists, psychologists, sports psychologists. It's all about having a good network and a good team. There's lots of great things that everyone can offer, and there's nobody that does it all. So having that network, I think, is important for treating the whole person, making sure each person is dealt with to the best that they can be.
Right. And each individual has such a unique journey as well in terms of what they may need for additional supports along the way.
Absolutely. Yeah, it's 100%.
So Ryan, if you could give one piece of advice to any athlete, whether it's that kid who's getting really competitive in their sport, a recreational athlete, or even someone who, weekend warrior gearing up to a major competition, what might that be?
I think ultimately sport or physical activity in general is just about having fun, being healthy, doing something that's good for your body. So if something hurts or just doesn't feel right, owe it to yourself to get it checked out. Whether it be, for kids, if they're doing a lot of additional training or they're training to play for an elite level team, just even getting, a screen to make sure that they're not going to set themselves up for problems down the road. If it's somebody that's taking up a sport recreationally or have started and they're starting to just feel little tweaks, twinges, get it looked at before it becomes something bigger than that. And then if it's, a more elite level athlete playing at a higher level, amateur or professional, often it's about just getting the edge in performance. Just a tenth of a second difference can be the difference between winning an event or scoring a basket or scoring a goal. And there's subtle things that can be done to help the body perform better and have someone be at their best.
Ryan, thanks so much for joining us today. I think this has been fascinating to really dive into the world of professional sport, but then also take a look at, how does physiotherapy help impact those everyday athletes and those that are just out trying to get active and live their best lives?
Well, thanks a lot for having me. I really appreciated being able to chat with you today.
Well, thank you so much. Thanks so much for listening today. We had a great conversation with Ryan, and I hope many of you learned something new. If you're interested in learning more about physiotherapy or to find a physiotherapist near you, visit albertaphysio.com. See you next time.